Alors, bonjour à toutes et à tous.
Hello, everybody, and welcome to this press conference with Premier François Legault, Health Minister Christian Dubé, and Public Health Director Horacio Arruda. Mr. Premier, welcome back to the National Assembly. The floor is yours. Hello, everybody. I want to begin by talking to you about nurses and the staff in the health network. First of all, I want to tell you that I am very conscious of the fact that the last 9 months were very difficult for the staff, in particular nurses with COVID, with the overload, with the workload. And right now, in our negotiations, we want to find all the means possible to lighten the load of nurses, amongst others. It's very clear it's our number one priority, not only during our negotiations with nurses, but even when I look at all of the negotiations with the 500,000 employees, state employees. The priority is to find how we can add some nurses. Obviously, you will tell me that we have to find them, so we have to agree on this. We can decide tomorrow morning to add a lot of nurses, but if we have posts, job posts, and they're not filled, that doesn't change the situation. What we are trying to do as well is to find all sorts of ways, all sorts of incentives, including financial incentives, so that more nurses will choose to work full-time. Currently, on our end and with the unions, we are working very hard in order to find some means to lighten the load. And I'm repeating this. I believe that all Quebecers want to thank the nurses and the staff in the healthcare network. It's impressive to see their strength and their courage after 9 months. And so we are with you. Now, if Quebecers want to help nurses, well, the right way to do so is to reduce the risks of getting COVID and to find ourselves in the hospital. We've got enough people in our hospitals. We don't have unlimited staff, so we must do all that we can in order to relieve the pressure on nurses and on the health network. Currently, we have a situation that's kind of particular because, contrary to the first wave, the places where there's the most virus is not the urban centers, it's not Montreal, it's not even Quebec. In fact, there are 6 regions or sub-regions where we've got difficulties. Obviously, there's a Saguenay-Lac-Saint-Jean. We've sent some staff, so there is staff from other regions that went to the Saguenay-Lac-Saint-Jean. Obviously, that indirectly puts pressure on the other regions. And there is some work being done on the care side and with the follow-ups. So there are some efforts to do. And this is the region where it's most difficult. I'm asking all people from the Saguenay-Lac-Saint-Jean, if you are able in the next few days and weeks to stay home, well, it'll help to reduce the pressure. We can see the number of cases has stabilized today, so there was no increase. So that is already some good news. There are other regions or sub-regions as well where we have to be more careful. In the Estrie, the RLS, asbestos and granite, there's a lot of cases in these 2 sub-regions. We're continuing to have a lot of cases in the Gaspé, in Côte de Gaspé, to be more specific. There are some problems in Joliette and Lanaudière-Nord. We've got a problem as well in Matane, in the Lower St. Lawrence, and there's also a problem near Sorel in the Montérégie. So the 6 regions, Saguenay-Lac-Saint-Jean, Estrie, Gaspé, Lanaudière-Nord, Lower St. Lawrence, and Sorel, these are the places where I'm asking Quebecers, if it's possible, to find any way possible to stay home. That is the most important point. The second thing that I wanted to tell you is you've got a graphic on the different residences that we have for the elderly As you can see, it's going very well in the CHSLDs, so that's good news. In the intermediary resources, it's also going well. Where we have a problem is in the RPAs, elderly homes. So you know that the CHSLDs are the places where people have less autonomy, so there's not a lot of people who leave. However, in the RPAs, it could be just a residence for the elderly, and there are some people who come and go. And we can see here, in particular today, look at the increase, and we've clearly got a problem in the RPAs. So I want to call upon all of those who live in RPAs. First of all, when you have people in your apartment, it's important that you respect the 2-meter distance and that you keep the mask on. And if you go visit somebody, once again, respect the 2-meter distance and make sure, if you go into the stores, that you are wearing a mask. We really have to make a lot of efforts in the RPAs. In the 6 regions that I've mentioned, there's a few of them where it's really because of the RPAs. That's where the outbreak started, and it's spreading. I want to come back to vaccination. Christian and Dr. Arruda are preparing as soon as we start getting the vaccine so that we're able to, in all regions of Quebec, vaccinate as quickly as possible. Now, there's a third vaccine that could be produced in big numbers. We're talking about billions, and it would be less difficult to store it because of the temperature that it has to be stored at. We can be optimistic. We're putting a lot of pressure on the federal government. We know that in certain places in Europe, in the U.S., they're even talking about getting some vaccines before Christmas. We haven't had news from the federal. The federal is negotiating with 6 companies, and we're very anxious to hear the date where we will be able to start vaccinating people. Obviously, it's going to be like a new life that's beginning again with this vaccination. However, it's not because there's a vaccine coming and that the good news are coming that we have to be less careful while we wait for the vaccine. I was hearing last week Dr. Fauci in the U.S. was saying that it's a little bit like when we go to war. We don't want to be amongst the last in the months right before the war ends. We don't want to die right before the war ends. So please don't take any chances. It would be really unfortunate to say a few months from the end of this pandemic, well, I got sick or somebody else did because I infected them. So we have to remain prudent until we all get vaccinated. Another topic that I want to come back to is a moral contract that we proposed last Thursday. I'm repeating myself. It's a contract that has 2 parties. On the one hand, we tell Quebecers, if things don't deteriorate, you will be able to see your families, maximum of 10, from the 24th to the 27th. But in exchange of this, and that's important, there has to be a week of quarantine before and after. Now I'm going to come back to the 4 days. Public Health has told us that there are 4 days available, but we only want 2 days to be used, so 2 days out of 4. So those who, if you drink too much, maybe take a day off, and 2 days later you can go see the other family, let's say. And of course, it excludes dinners for people who live in a household. When we say 2, it's 2 plus the suppers or the parties that we can have with people who already live in the same household. But I want to come back to the second part of the contract, and that is the quarantine for 1 week. There are some people who will not be able to quarantine for a week before the Christmas supper. These people, I'm sure that they don't want to infect or take the risk of infecting members of their own family. So if you are not able to quarantine 1 week before Christmas, it is better to not go to the Christmas dinner. And there are some people who have said, why a week, why not 2 weeks? What public health tells us is that within 7 days, usually we will develop the symptoms. And I'll repeat myself, if in the week before the Christmas supper you have symptoms, well, you must stay home. So we are respecting the 7-day period. That's very important. Perhaps a last topic. Vacation abroad. I've got a bit of difficulty with that. I understand that there are some people who perhaps have no choice for all sorts of reasons. They have to go abroad. But going into an all-inclusive with a bunch of people, let's remember what happened after spring break. In March, we had all sorts of Quebecers who came back home. They had COVID. And we can say, well, that's their problem. They can quarantine for a couple of weeks. But still, there are some who will be ill and who will end up in our hospitals. And they will increase the workload of the staff and the health networks. So it's really not a good idea to go vacation abroad over the next few weeks and months. As long as a vaccine is not available, it is not recommended at all, at all. So I'll close by telling you that we can see the light at the end of the tunnel. I'm convinced that together we'll be able to get through this, and our challenge for the next few months is to keep our morale up. It was long, 9 months. We still have some months ahead of us. So let's stay positive.
Good afternoon, everyone. First, I would like to say a few words about our nurses and our health workers. I know the last 9 months have been very difficult. Our priority is to do everything we can to help you in this difficult work. I want to thank our nurses, and the best way to thank them is to continue our fight against the virus. Right now, we have some regions with a high number of cases. Saguenay-Lac-Saint-Jean, Asbestos and Granite in Estrie, Côte-de-Gaspé, Lanaudière-Nord, Matane, and Sorel. I ask the people of these regions to be even more careful. The virus is more present in your area. I also want to ask people who live in senior homes to be very careful, especially until Christmas. We still have a few months of efforts ahead of us. Our team is preparing the vaccination in every region of Quebec, and we're waiting for Ottawa to know when we'll have the vaccine. We hope to be able to announce it in the next few days. We know the battle is coming to an end, but we must continue all our efforts. Also want to say a few words about our moral contract for Christmas. Public health authorities told us that we have to limit ourselves to 2 gatherings, so we can only organize 2 events with people who don't live with us. We must also refrain from traveling outside Quebec. If you do so, you might come back with the virus, and it's not good for our health system. We're finally seeing the end of it. Our challenge is to keep morale up for the remaining months. Thank you.
Thank you. We will now go to the question period. Question. You spoke about vaccination a few minutes ago. We saw yesterday Ontario named a former general to handle the operations. Spain and Germany also have detailed plans. When will you have a plan that is just as detailed in the way that it will roll out, who will be prioritized and in what regions? And Dr. Drouin yesterday talked about January to start this operation. Does that seem realistic to you? What I would like to tell people is that in Quebec, we've got a lot of experience when it comes to vaccination. It goes back several years. We can think about H1N1, but also recently, all the work that's being done by our teams for the vaccination against influenza. Just to give you an example of what's happening in the field currently, is more than 200,000 people per week who are currently being vaccinated in a context that is completely different than last year's. And that is that we are now vaccinating with the collaboration of pharmacists, and we are very satisfied. We are close to 800,000 people who have been vaccinated since the beginning of the period. So the parallel, and the reason why I'm making this parallel, in answer to your question, Mr. Lavallée, is that we began a while ago to draw a parallel for us and to say, what are the things that we're doing well now when it comes to the flu shot, in which we'll need in terms of people. Obviously, when we include certain variables, and I'm in discussions with public health and with the Premier, depending on the level or at what speed we will get the vaccines and how many, well, obviously the scenarios that we're talking about now with the Premier, so we may need to have more than 200,000 people vaccinated per week because it's possible that we'll have a lot of vaccines. So for us, will we go further than, for example, the pharmacists or their other professional orders? We're preparing all of this. These discussions are ongoing, and that is why in the next few weeks, well, for us, not only will we be ready, but I will tell you that we are already ready. And what's important for us is to have the information from the federal government, as the Premier mentioned, but I can tell you that we got some people who are operational people, because remember, why are things going better when it comes to screening now? Why is it going better when it comes to vaccinations? It's because we made a difference in public health between what was strategic and operational. We already got some people who had this operational experience. I talked about Jérôme Gagnon, who joined us. He's from public security. So we are in preparations, and we will be ready, as we're ready for the flu vaccination now, and we will be ready for the COVID vaccination. On another topic, you may have seen this on the news yesterday. On the Saint-Jérôme Hospital, we heard that there were 277 people who got COVID at the hospital since the beginning of the pandemic. This brought about 76 deaths. We're talking about multiple rooms that were open and beds that were close to each other in the emergency department. How come in Saint-Jérôme they haven't learned any lessons from the first wave? Will you intervene? And what about the timeline for the rebuilding of the hospital? Apparently it's not going to be before 2029, 2030. That seems to be very far. So is there something that you can do to, well, first of all, with Saint-Jérôme, I'll remind you, I went on site this summer, right away when I was given the mandate, because we knew that this was a hospital that was problematic and that had problems in the first wave. So I went on site to see what were the issues. We've done an investment of a module to improve the way that we will serve people in the emergency department. That is being built currently. So it's not in years. It's going to be the next few weeks. And thirdly, what we are looking at, given the state of the rooms, how can we accelerate what we could do in order to be able to renovate significantly the hospital in Saint-Jérôme? So I've heard the declarations, the statements of the past few days, but for us, this file is still a priority, and even more of a priority because of the state of the hospital. A question, Mr. Premier, we know that the devil is in the details, and here you're talking about clarifications concerning your moral contract. Now we have the impression in Quebec that the bar is open for 4 days. People will be able to gather more than once in a day, that we'll find ourselves with 60, 80, 90, 120 people at the end of that 4 days. It seems that you've left the door open to just about anything. It's a free-for-all. No. What we were aiming for, I look on my end, there's going to be one night for the Bray and one night for the Legauts, and that is what we will limit ourselves to. So there will be 2 gatherings with a maximum of 10 people. So that was clarified. Perhaps it wasn't clear, but we're talking about 2 gatherings maximum. Obviously, I will have a Christmas Eve with my sons who live with me, so that doesn't count. Now, with what happened over the past few days, a religious gathering to denounce the mask wearing, a dance in a shopping center, it seems to be spreading. What do you have the intention to do? And at some point, will people have the impression that there are actions that are undertaken? Well, we are in discussions with the police to see if they need additional budget, additional money. But what we want is that there be monitoring that is done. For these events, and also we want to make sure that there are no gatherings on the 1st of January. So we have asked police forces to prepare a type of plan so that we know that there's follow-up, whether it's in churches, in shopping centers, or even on the 1st of January in homes. Question? Mr. Legault, you're saying, and perhaps it wasn't clear enough, but last week you had announced these 4 days. We understood the 10-person limit, but we didn't talk about the number of gatherings. So what happened since last Thursday so that that led you to correct your messaging? Well, we got clearer instructions from public health. They told us, in our mind, there's a 4-day period, but it can't be more than 2 gatherings over those 4 days. What's important, we concentrated the gatherings over an initial period of time at the beginning of the Christmas holiday, regardless of religions or whatever. It's just because it's at the beginning, with a quarantine before and a quarantine after. The reason why we gave 4 days is to allow flexibility, and that is, there are some parents who have shared custody. There are some people who work on the 24th and 25th. They don't work on the 26th and 27th. That's why we gave the 4-day period. But after that, I will tell you, we want as few gatherings as possible. The closer you stick to your household, the better it is. Every time that you go to 10, every time that you bring somebody from another bubble, from another social network, a friend or whatever, they have their own network, you're increasing your own risk. So the instructions, if you're afraid and you don't feel like celebrating, that's fine. We respect it. That's your choice. And then afterwards, do it, maximum of 2 gatherings, ideally 1 if possible. It's not a period of time to party. Yes, it's a period of time to gather as a family, but it's not the Copacabana and the Rio Festival that we're asking you to do. Please, because each additional contact is a risk. The situation is still quite fragile, and I'm telling you, right now, we need to decrease the rates if we want to be able to have these 2 gatherings at Christmas time. Today you're insisting on the importance of having a quarantine for 1 week before. You're talking about, I think that Ottawa is recommending 14 days. I understand that the symptoms appear in the first 7 days, but in the day-to-day lives of people, so that they understand correctly. How does that work? For 7 days before Christmas, we don't go to the grocery store, and we don't go to the grocery store 7 days after? Well, ideally, we take no risks. Is it possible to leave the house while respecting the 2 meters with a mask? Perhaps. But let's think. We've got our brother or sister, our mother, father, that we will go see on the 25th or the 26th. And if ever we are infected, we can transmit the illness to them. So let's think about that. And let's be sure that we're not taking unnecessary risk. The ideal scenario is to stay home 1 week before, so to do your shopping before. Question? As it pertains to this, since you have made this announcement, your moral contract last week, there are several people who believe that, they're planning all sorts of stuff, and we have the impression that that request to isolate is not understood correctly. Have you thought about, or will you impose more restrictions on Quebecers 1 week before and 1 week after? Is this a formula that you've thought about? No, except for the schools, because people have the choice to not gather. So it's up to each individual to decide, am I at risk with my family or am I not at risk? If I believe that I'm at risk, well, I'm not going to go to the gathering. It's not mandatory. People don't all have to gather on the 25th, but if they do want to gather, It seems to me that the last thing that we want is to risk infecting somebody from our family. A second question has to do with what was announced by Mr. Jolin Barrette earlier. It's reform of Bill 101. Do you think that we must impose or broaden the application of Bill 101 to CEGEPs? For the time being, it's not part of our program. We will table at the beginning of 2021 our proposals. We have started to have discussions with the caucus and with the cabinet. I think that what Simon was talking about today is to have unanimous support from the National Assembly in order to ask the federal government to apply Bill 101 to federal businesses. Well, listen, it's part of the discussions. Question. We're the 25th of November, exactly a month away from Christmas. You're saying that in certain regions it's still more difficult. The plateau has been increasing a little bit for the past few weeks. Now, this plan or this moral contract, in your opinion, Mr. Legault, could it be adapted depending on the regions? Or anyway, will it be applied to all of Quebec, or could it depend on the regions? Well, I hate contradicting you, but we're the 24th of November today, not the 25th. Well, you have an extra day. Okay, well, 1 month away from Christmas Eve. Ah, that's what you meant. Okay. For the time being, given the 1-week quarantine before and after, it's not a question of religion. We want it to apply everywhere. It's not a question of regions, but everywhere where people are ready to do a quarantine before and after. I'll bring you to another topic. On the Quebec port, the Bloc Québécois is saying that to defend the interests of Quebec in Ottawa, they're asking, actually, well, their demand for the Port of Quebec is that it be subject to Quebec's environmental laws. Is that also your position? Yes, but there's still work to be done on this project in order to well assess the impacts on the environment. So we are getting familiar with the report that was published last week, but we want to make sure, of course, that there will be a formula to make sure that we know what the impacts on the environment will be. Question. I'd like to come back to the topic of the FIC. You talked about the incentives that you would like to put in place. What are you ready to do when it comes to salaries? Well, I will not negotiate in the public square. And the priority currently is truly to lighten the workload. So we are working on working conditions. You know, the FIC and other unions represent a lot of employees from many different sectors. So currently, there's a salary offer, but in the case of the FIC, we are really discussing working conditions, means to lighten the load for nurses. And now, the RPAs, we're looking at the numbers, and we're referring as well to parents that we visit in residences. So, with the Christmas holiday, what do you recommend for people who want to go visit their parents in the RPA during the holiday season? Can we ensure them that they will be tested before they go visit if they don't want to put their parents at risk? For example, could RPAs could also say no or refuse external visitors to avoid this kind of transmission? Well, I'd like to rectify something. I heard the leader of the Liberal Party talking about tests for people who don't have symptoms, and that would give a false guarantee. There is nothing, somebody can test negative but still have the virus. The real solution is to be in a quarantine before gathering the people who live in the RPAs as well as the people who will go visit. So, could RPAs restrict the number of visits? When we made the announcement last week, well, we will publish a guide Public Health will publish a guide, and that will really provide very detailed instructions for the CHSLDs, the RPAs, and I think that people with this guide, which will come out in the next few days, will have all the answers to their questions. Question? Clarification, Dr. Arruda. Am I to understand that the number of cases will have to decrease in order for us to have that 4-day period for gatherings? I would say that it's going to be a combination of the number of cases, hospitalizations, and the capacity of the teams to do contact tracing. I would say that ideally, I would like it to decrease because the higher the number of cases, the greater the exposure during the holidays. So I invite Quebecers to make some efforts by the 17th of December. And if we reduce our contacts, it'll be very beneficial. So the population has to be conscious. What's an acceptable number of cases for you for the Christmas gatherings? I would say under 1,000 would be, given that we're maintained at below 1,000, but once again, we'll have to see the capacity in hospitals and the contact tracing and the number of outbreaks. Mr. Dubé, the Committee of Experts on Ventilation for Schools, are there any conclusions? Will we act? Well, yes, thank you, Mr. Chouinard, for the question. As we had said when we talked about it the first time, the committee was created. There are some experts, external experts, who were contacted. A few meetings have been held. We've even, well, given the urgency, more in health, particularly in our establishments, which were in the red zone. I'm talking about hot zones in certain CHSLDs. We sent some people to do some tests last week, and these tests will be analyzed by our experts in the next few days. And I expect a report at the latest in 10 days from now of these tests that were done and analyzed by the experts. So we are on track, but right now the priority is health establishments, given what we've got, especially in the CHSLDs, where we want to make sure that the red zones are well ventilated and that there's no danger linked to ventilation. So the group is working, and they will come up with recommendations, and perhaps they will have recommendations that are aligned with what we've had since the beginning with public health. But I would rather let the experts propose their recommendations. Question. Mr. Legault, you talked about the residents and RPAs who perhaps should be a bit more careful in order to avoid outbreaks, but there are already several RPAs that have outbreaks. In certain cases, we're talking about 96% of residents who are infected. So big outbreaks, what can we do once there's a fire in these RPAs? Sending the SWAT teams, or are we thinking about that? It's hard for me to show you the graphic here, but first of all, what I want to show you is that there's not only the number of cases that you see, which has exploded in the past day. When you look at the RPA on the right, you see the last column, there's an increase. But what's important to look at is a red line. I don't know if you can see it from there, but the red line is a number of RPAs that have more than 25% cases, and that's what we call our critical establishments, or in a critical phase. And if I compare, look at the CHSLDs on the left. We've increased up until 12 CHSLDs, which were critical a few weeks ago, and we're back down to 3. That's just to show you that because we sent the right teams, we were able to control the outbreaks. And that means that today we've got around 40 cases total in our 400 CHSLDs. So when we tell you that the situation is under control in the CHSLDs, it's not only the number of cases, but the number of CHSLDs that are in a critical zone. Now, to come back to your question on the RPAs, for me, it's not necessarily the day that I'm worried about, having one day with close to 160 cases in the RPAs, whereas we had 60 yesterday. And that is 100 cases that we should not have in our 1,000 cases today. Imagine if we didn't have these 3 RPAs today, we would be below 1,000 cases, which is quite incredible. I've got 2 of these 3 RPAs in the Lac Saint-Jean. So, to answer your question, it's very targeted. The work that we have to do in the RPAs is very targeted, but that depends quite a bit on the citizens as well, because we are in an environment that is very different than the CHSLDs. These are people who come and go. These are people who go in the shopping centers, or people who get visitors. We don't have the same control. And that is why today what the Premier is saying is that be careful, because in the next month, we truly have to control the RPAs and control the number of RPAs where we have outbreaks. So the best thing we can do in the next few days is to tell these people, not only when are you at home, but when you travel about in your establishment, in your residence, wear your mask, keep the 2-meter distance, but in their case, when you leave, when you go visit somebody, when you go to the grocery store, when you go to the shopping center, that is where you have to make sure that you are very prudent, because you could be the person that will bring the virus into the RPA and transmit it. So I'm very satisfied with the work that was accomplished in the CHSLDs, but now we wanted to raise your awareness as to the importance and the work in the RPA, particularly by the users themselves, who come and go in the RPAs. Mr. Legault, the Canadian Public Servants Union, which was before the National Assembly today, they wanted to highlight the memory of the 12 employees from the health network who died from COVID-19 since the beginning of the pandemic. We also saw 45 deaths that were added today. You had alluded a few months ago to a possible way of honoring the memory of people who died from COVID-19. So where are we with that? Well, there are some scenarios on the table. The person who's in charge of the protocol is looking to see when this will occur. A possibility that's on the table is that it will be on the anniversary of the beginning of the pandemic, so at the beginning of March 2021, but the exact date is not set. And the way of there are several scenarios on the table. We will see how the pandemic will evolve over the next few days and weeks. Question. My question is for Mr. Zubé. I would like to know, concerning the directives that we're giving to ambulance technicians in Montreal and Laval, should this have been presented to a Code of Ethics committee before being applied? I want to be careful with hypothetical questions. The first thing that I would like to tell you is that I was made aware of that guideline, and when we look at today's context, it's difficult to accept, and that's to demonstrate how the first wave was virulent, because especially in the Montreal region, I think the instructions were for Montreal and Laval from what I was told over the past few days, and it's because it was truly problematic, and we're not there today. This directive, to be very clear, was lifted. We no longer have a directive where there are requests to minimize reanimation. From what I understand, and it's important that the population understand, in all cases, what was requested of people from Urgence Santé is to do as much as they could to reanimate the people. But once they had made the maximum effort, and we're talking about using defibrillators, and so we said, do your best, but if you see that it's a lost cause or somebody where you've done the maximum and there's no effect, well, you are allowed to stop. But it was still left up to the judgment of the ambulance technicians. But I'm repeating myself today, that directive is no longer in place, and we really don't believe that there will be a directive of that kind, because we don't have the same situation anymore, not at all, and we don't want to go there. I'm not sure that I've understood your answer concerning the ethics committee, because for hospitals there's an ethics committee. Well, it's not up to me to say if there should have been or not an ethics committee, but what we did, the way that we've been working over the past few months, and for example, I do this in the case of handicapped people, we did the work that you are alluding to. We went and got some experts to look at everything that we could do for handicapped people, and there was some work done on this, but I can't go back in the past, especially at the beginning of the crisis. Things were moving so fast, and people had to make decisions quickly, and they did to the best of their knowledge. And I don't want to comment further on this. We will now go to the English questions.
Good afternoon. Hanukkah starts on December 10th. If a family wants to gather during Hanukkah, for instance, and they prefer to isolate for 7 days, is that allowed?
No. Reason for that is that we pick the date with the actual dates that are planned every year during the end of December. So what we want is to have all the gatherings concentrated 24 to 27. So if we had, for example, something for Hanukkah, let's say on the 17th, it means that we would have to do something starting on December 10 in schools, in companies. So it's not reasonable to ask for that. So it's really, we've planned those four dates, first starting with the calendar of the different schools in Quebec, and we've tried to minimize the number of school days that will be lost by the students.
So just to be clear, then, it would be more of a worry that, like children, for instance, could bring the virus from school into a gathering because the schools would still be open during that time?
But we are asking schools and businesses to make efforts for the 7 days before the gatherings to be closed. But it wouldn't be reasonable to do that, let's say, before the 10th or the 18th of December.
Stéphane Giroux, CTV.
Mr. Legault, two questions. First of all, your colleague, Brian Pallister, Premier of Manitoba, over there they have an infection rate similar to Quebec at this point. He's calling your Christmas plan dangerous. And he says that even with an infection rate similar in Manitoba, there is no way he would try something similar.
Okay. First, the rate, the number of cases, the number of new cases per million of residents is higher now in Manitoba than here. Second, I want to remember to my friend Brian that we're talking about a maximum of 10 people per house. And also we're asking for a quarantine of 7 days before the gathering. So I don't know if he's aware of all these requirements.
My second question, this morning again, small businesses, especially restaurants, are starting to really lose it. They see the holiday season, usually a busy one. They will have to remain closed, of course, until at least until January 11th. They're asking for some sort of handout to survive. Otherwise, they keep repeating, we will be closing, we will lose our businesses. Can you tell them anything that will reassure them?
Okay, are you talking about reopening, about paying for 80% of their rent?
Helping them.
Okay, helping them. Okay. Pierre Fitzgibbon is well aware of the problems we have in some places, right? I think that the vast majority of them got their money. But we have, first for small restaurants, we've decided, and I think it was a good decision, to give the money to the MRC. And the MRC are paying on the showing of invoices all restaurants, smaller restaurants. The money we've transferred, the government has transferred the money in the bank account of the MRC, but in some MRC, maybe they are not well equipped, and we're pushing. And I can tell you that Pierre Fitzgibbon is pushing a lot. I'm pushing Pierre. Pierre is pushing, and I want that to be solved. But I know also that some restaurants, for all kind of reasons, they don't want to present invoices or a proof of the rent they pay. So, of course, we manage the money of Quebecers, so we cannot pay without having any proof that they paid so much for the rent, so much for the taxes, etc. So some are unhappy because we are asking invoices.
Cathy Sonnet, CBC.
Hi. Premier Doug Ford yesterday announced that Rick Hiller was in charge of the task force. He's very proud. This is the right person, the best person across Canada to be in charge of such operation. And we know the number of doses in Ontario. We have some details about the operation. Compared to this, Quebec doesn't seem to be ready. Is it a tactic so people in Quebec don't put their guard down?
No, it's not a tactic. We have in mind the person we want to put responsible. It's not somebody coming from the army, I can tell you that. And we're also designing different scenarios depending, like Christian said, of the number of vaccines we have to give every week. If we get 200,000 vaccine a week, it's something. If we get 2 million vaccine a week, it's another story. So we're looking at the different scenarios, and I'm very anxious to get more information from Mr. Trudeau about when will it start, how many will we receive. Very anxious. In the meantime, we're getting ready, so we'll have somebody responsible for, and we'll have a certain quantity of people that will be ready, depending of how many vaccines we receive and when we receive them.
Okay. You said that Quebecers will receive a guide what to do in CHSLDs and private residences with Christmas coming, but how risky is it to allow Christmas get-togethers with people in CHSLDs?
Well, that's the reason we want to make sure that there is no conflicting information that is being explained. And I think that's the reason I would limit my comment. This is one of the reasons we ask Santé Publique to provide detail for each type, because it's, as I mentioned earlier, the rules for a CHSLD and the rules for an RPA are totally different. So that's the reason, instead of starting to explain how many can come, how many can you take somebody out of a CHSLD, that's a big issue. But as you know, those people are usually not mobile and they are very vulnerable. So instead of discussing that, we've asked Santé Publique to prepare a detailed guide, and I was told that this should be ready this week. So people will have the information on that.
Raquel Fletcher, Global.
Good afternoon. My question is for Premier Legault. Premier, can you explain your reflection about CEGEPs and bringing them under Bill 101? Earlier, it seemed like Mr. Jolin Barrette was saying that he's reflecting on it, but that this was going to be part of what he is tabling in the next session. And then you have said that won't be part of the bill. So there's a bit of confusion here.
No, what I said is that it's part of the discussions right now we have with our caucus, and no decision is taken, and we'll table a bill at the beginning of 2021, but there's no decision taken.
Okay, so you're going to table a bill, but the CEGEP part of it is not going to be in that bill?
We don't know at this point.
Okay. My next question is for Mr. Dubé about the SWAT teams that you've called into certain seniors' residences. I'm wondering if you're considering something similar for the Maimonides home in Côte-Saint-Luc. My colleague is working on a story today. He says cases among residents have jumped by at least a third in 1 week to more than 40, and that's in addition to almost 20 staff. Residents and family say that there's been serious understaffing and that they need help.
Well, first, as we've done in all the cases where we have been able to control the situation everywhere. We ask the local authority if they need help. If they don't, we monitor with them the situation. But if they require help, we push the number of people in PCI that are required. So in the case that you're talking about, I'll see, but we have those meetings every morning at 7 o'clock. We look at the situation in all those CHSLD, APA. So if that one needs to have external assistance, we'll provide them with the right assistance. That's for sure.
Merci. Puisqu'il reste 2 minutes,
There are 2 minutes left. So here's a question sent by Catherine Boulian from Le Quotidien. Here's a question. A gym in Alma, whose co-owner is a member of the Sûreté du Québec, got a fine because they maintain their activities despite the restrictions imposed in the red zone. How can we explain that in the most impacted region, somebody from the Sûreté du Québec is operating a gym despite the restrictions that are in place? Will there be sanctions applied to the police officer who's involved in this? That's a very good question, and I would want to ask that question to the police officer in question, but currently we're looking at the situation. Thank you, and that is it for the press conference. Thank you.